Actually, the state has geared itself up. We are working in close coordination with Government of India, and already, as you have seen yesterday, we had a detailed inspection of the state vaccine center. 51 locations we have created, new walk-in coolers which can store up to 2.5 crore vaccines. Today I also inspected the Government of India's drugstore. We have a central government thing where they have both dry storage and also the regular vaccine storage. They are ready to receive the supplies as and when the Government of India gives its transportation schedule. And as far as the needles and syringes are concerned, they have already, Tamil Nadu has been allocated around 33 lakh needles and syringes, of which 28 lakhs have already come. So district level reallocation has been done. We are sending it to the districts. At the district level, already we have almost 2,800 secondary care points, secondary cold storage point, 2880. So they also, we have requested the collectors to get the main TNMS's new centers, walk-in coolers inspected, and the secondary cold storage centers inspected, and parallelly we should also, all the districts have to go for a dry run as per Government of India's directions on 8th. So we are telling that, like booth inspection, election booth inspection, our teams, 5 vaccinators and the computer setup and the physical setup of the center with a observation room, a waiting room, a vaccination room and observation room, separate entry, separate exit, adequate space for social distancing, the network connectivity, a place, adequate medicines, etc. in case of adverse event. Those things should be done in the dry run, and there should be sample check at the higher level also. So everything is going as per schedule. Today also we had a detailed inspection of the central drug store also. They are also prepared. In fact, they not only cater to Tamil Nadu but also to the southern region as far as all the vaccines are concerned. Perhaps this time, based on the Government of India schedule, we will get to know whether we get it directly or through the regional center, which is again at the heart of Chennai city only. No, tomorrow we have a meeting at the Union Health Minister and the State Health Ministers and all. We are regularly once or twice a day we are in touch with them. They are also dynamically giving us guidances. So at present our focus is more on our role, where we have to prepare the physical centers. But one thing which all of us have to understand, why we may have 47,000 sites for vaccination for all the people. Now our primary focus is 6 lakh people who are registered as healthcare workers. So those places will be far lesser. What is the requirement? Adequacy of space, adequacy of personnel. Though Tamil Nadu boasts of maximum number of health personnel, one of the largest health personnel, still these are exercises where we have to do it with a lot of abundant caution. We cannot be overconfident. We have to keep on going through the drill and the instructions which we get from time to time from Government of India.
How much vaccine per day?
Actually, we are planning, as per the present instructions, only 100 persons in a site. You can say it takes 5 to 6 minutes, and we have to observe also this being a new vaccine and all. So we have adequate sites ready. As I told you, 47,000 sites we have kept ready. 21,000 vaccinators have been trained. But at present, for the healthcare workers, I expect that not more than 3,000 sites will be required in the initial phase. But as we keep getting the supplies, in case we get much more than what has been, it all depends on the Government of India's schedule of supply. We should be prepared to go for immediate, increasing the thing. So as far as the training, as far as the planning is concerned, it is for the entire system. But once we get the supply, and as and when we are indicated the date, we will be looking at the healthcare workers first.